Towards the end of your booklet are the exercises that we would like you to do after surgery. The purpose of the exercises are to help you regain full range of motion in your shoulders as soon as possible after surgery and to help with pain management. With the exercises, we would like you to perform them every day, 3 times a day. For that reason, we recommend incorporating them in your regular schedule so you don't forget. So maybe after breakfast, lunch, or dinner, and whatever works best for you that day. And if pain is an issue, it might be a good idea to take your pain medication about 20 to 30 minutes before, so that when you do your exercises, you feel a bit more comfortable and you get a greater benefit out of them. The exercises are divided into 2 stages. Stage 1, you start the day after you go home from the hospital. And stage 2, you only start once all of your drains have been removed. Right now, we will demonstrate your stage 1 exercises that we want you to do the day after you go home from the hospital. The first exercise we want you to do is called Pump It Up. For this exercise, you are going to lie down either on a bed or on a couch. And with the arm on the side that had surgery is going to be on top of a pillow. It's called Pump It Up because you will be doing a pumping motion with that arm, meaning you will bend your elbow and make a fist, and then straighten everything. And then again, bend your elbow and make a fist, and straighten your arms and your fingers. You will be doing that motion 20 times back and forth. It does not matter the speed of the motion, just as long as you do 20. The reason why we have you in a side lying position is because we want this arm above the level of the heart. It helps prevent fluid from building up in the arm after surgery. If you've had surgery on both sides of your body, after 20, you will flip over to the opposite side and support the opposite arm on the pillow. And again, do 20 repetitions back and forth. For exercise number 2, the shoulder circles, the best position is to do it either sitting up or standing. For number 2, you will just be doing small circles with your shoulders, 5 slow circles forwards, and then 5 slow circles backwards. Initially, you may only be able to tolerate doing smaller circles because of pain, but once the tissues stretch and the pain improves, you will be able to do big circles again. Exercise number 3, the arm lifts. You're going to sit with your hands clasped in front of your chest, and then slowly raise your arms up as high as you feel comfortable until you feel a nice stretch in your incision areas, but no pain. The reason we don't want you in pain is because you need to hold this position. We would like you to hold this position for 10 seconds or 5 deep breaths. And once you've completed 5 deep breaths, you're going to return to the start position and repeat 5 to 10 times. The very last exercise for stage 1, the shoulder blade squeeze. What you will be doing is standing or sitting with your arms bent at your side. Just be mindful of your drains. And the motion is we want you to slowly slide your arms back, trying to make your elbows touch behind your back by squeezing your shoulder blades. Only go as far as you can until you feel a nice stretch, but no pain, because again, you will be holding this position for 10 seconds or 5 deep breaths. And again, after the 5th breath, you will relax and repeat the motion 5 to 10 more times.